MEB part two. All right, so what you got to do? First video I talk about the physical aspect of getting injuries during your military service, or if you had injuries prior to your service and you went in jacked up, but they still accepted you, and your injuries got exacerbated by whatever you did in the military. So this is part two. This is the behavioral health part, EBH. You got EBH clinics um, by your units, right? So it's an intake. You could do a self intake. You just go in there, you check yourself in. It's like, I want to talk to somebody, right? And then, that's one way of doing it. Or if you're acting like all crazy, and you're drinking, and you're getting DUIs, or you're just acting amuck, and your line leaders passing up that information that you're not conducting yourself properly as a soldier on the weekends, then the CEO could be like, hey, you got to go to EBH, man. You got some things on your mind that you got to go. And then so you go, right? This is before like the MEB process. So this is like months or a year out before you're like a P3 tier 3 profile. Um, your profile's what you call it, permanent. So I'm gonna go back. So EBH, check yourself in. You'll have a questionnaire. Be straight up with your questionnaire. It's gonna say some crazy stuff, but you're at EBH for a reason. So let's be honest. There's group therapy there. Everyone goes in there, and they go in a group, talk about your problems. You go. There's a curriculum that they go by, and yeah, that's cool. And then there's one-on-one sessions, right? If you can't sleep, you got depression, you have insomnia, you got marriage issues, you got financial issues, and it's straining you from doing your job because you can't focus doing your job. Or you got anger issues, you snap, you got triggers that just set you off, and you're just gonna just be this Hulk, you know, dude, and just be all upset. You go in and you talk about those things. They're gonna ask you, you're suicidal, whatever. Just be honest. Like, hey, yeah, it's a commercial. I think about it all the time. It's a commercial, but I don't do nothing. I'm not planning to hurt myself. But you say you're trying to plan to hurt yourself, whatever. Then they're gonna call um, probably the ambulance, and then you're gonna get submitted in emergency room, and you're gonna have some type of 24 to 48 hours, I guess, of suicide watch at the behavioral health clinic at the hospital. But anyways, so back to MEB. You'll get a diagnosis, right? The psychiatrist or the counselor. Oh yeah, EBH too. There's a psychiatrist there, so the counselor will talk to you, and then as you keep going, they'll recommend medication to kind of calm down your symptoms and your conditions. So you'll do that, and then uh, take your meds, refill them, go to your follow ups to refill them, because normally it's like a 30-day refill, and then you gotta go in for a follow up before your prescription runs out. I would stay on top of that. You don't want to go cold turkey and just be dry for a week, and then your symptoms get worse because you're off your meds. So stay on your meds. Continuity with your meds is a big deal. Keep a paper trail of that. And so that's the psychiatrist part, right? The counseling part, just say your piece, say what's on your mind, be straight up. If you're pissed off, show that you're pissed off. If you know what I'm saying, don't go in there and they say, hey, soldier, how you doing today? Oh, I'm doing great. They don't want to hear that. They want to hear what's really going on. Like, hey, how you doing today? You know what? I'm upset. I didn't sleep last night. I haven't slept, for like 2 days. I have insomnia. I just got my mind's racing, and I just don't know how to calm down. I can't focus right because I don't sleep, and everything falls into play where they start connecting the dots. But if you don't say anything, if you say you're having a good day, but I'm at EBH, I just want to stop by, have a follow up, and say hi, then it's gonna be like, nah, you're good, or if you're not good, then you're lying to yourself. So just be straight up, be honest. Yeah, your CEO is gonna know that you're going to EBH because they contacted CEO. Whatever, handle your business. Like I said, the military was here before you. It's gonna be here after you. No one cares. So care about yourself. If you can't care about yourself, then how are you gonna care about others? Because you're supposed to be a leader in the military. So yeah, do that. Once you get your diagnosis, you'll be on some type of profile, right? Because there's something wrong. So you have continuity of going to your appointments, going to your follow-ups. There's a trail of counselings that you go in there and you talk about whatever you talk about, and they go off of the DSM-5 book, and basically it's like they check the block, like he has these symptoms, so under the umbrella of PTSD, he has PTSD because it's an umbrella thing. Like, you have insomnia, you have anxiety, social anxiety, you have depression, you have anger issues, then they'll just put all that under the umbrella of PTSD. That's just an example. And get proper treatment. I had like three counselors, man, and like the first one, he was a good dude, chopping it up, and he just bounced. I don't know where he went. He just bounced, and I was like, all right, cool, okay. And then I come back, and then I had another lady, and then she retired. So I'm like, dang. And then I had another person, and this person was like, yeah, you got this and this and this and this, but I'm not gonna diagnose you because I don't know you. I was just like, all right, cool. I don't want to talk to you. I'm not talking to you. I want to talk to someone else. Someone that wants to do their job professionally. I don't know what this is about, but I'm not going to talk to you no more. And when I went to the follow-up to talk to the psychiatrist, I was like, hey, sir, because he's a doctor. So I was like, sir, this is what's been going on. I don't want to talk to this person no more. It's a conflict of interest or something. I don't know, but there's something that was said or something. Then she doesn't want to diagnose me. All right, cool. He said, go back one time and then see what happens. I'll talk to her. Okay, I go back. She's like, here's some breathing methods. So instead of like getting down to business and be like, hey, DSM-5, you got these symptoms, I'm gonna diagnose you with this or whatever. She didn't do that. She was like, here's some breathing methods. It's on YouTube. Here you go. I'm like, man, what? Okay. I've been breathing my whole life out the womb. So I know how to breathe. What are you doing? Right? But that, I don't know, whatever. She's like, oh, count to 10, this and that. I'm like, okay, cool. So is this a countdown where I'm going to smash on somebody? Or is this a countdown to like calm myself down? Because I don't know how to calm myself down, right? But yeah, so proper treatment, go get proper treatment. If you're not down with the results or the treatment that you're receiving, speak up, say something. Go get your spouse to speak up for you, because she or he is a civilian, and they could just say what's on their mind. Um, or if you just want to handle it yourself, go handle it. Go handle your business and say what you got to say. But there's you can get in, you get into some crap with that if you hurt an officer's feeling. But anyways, so um, your medication, stick to your medication. So again, continuity. You could check in to EBH. You don't need to. No one needs to refer you. You could just walk in, just be like, "Hey, I want to. I'm here for an intake. I want to talk to somebody." And that's all you gotta say. You ain't gotta say why. You just gotta say, "I gotta talk to somebody," and then you'll stay there for a little bit, and then you go in, and then that's where that process starts of you getting treatment and you getting medications for your symptoms or whatever you're trying to seek. Just be transparent. Let them know how you feel, and yeah, that's it. But the big part is being transparent. I mean, everything, all these things matter, but being transparent when you're in front of somebody that's trying to figure out what's going on in your head, because your reality is not their reality. Um, you got triggers that they need to identify, and if you're just like hunkering down, covering up your emotions and how you feel real time, then they're not gonna know. They're just gonna be like, okay, well. I guess just come back next time, or come back when you feel bad or something. They see people every single day. This is their job. Every single day they see somebody. So if you act like the same guy that just came out, they're just gonna be like, these guys are fine. They just want to get out of work, or they just want to do, they don't want to go to the field, or they don't want to do something. They don't want to do CQ or fire guard, ammo guard, or they don't want to do something. So they're checking in. You know, they're checking in to EBH, or I have an appointment. Like nah. Like if you're hurt, if you're injured, if you got some stuff on your mind that just you can't just shake on your own. You need some medical assistance. Go get some help. If your treatment ain't cool, say, hey, I don't want to work with this person. Oh, nurse advocacy. Your nurse advocate. It's at the clinic. If the receptionist in the front is being all crazy, then you just be like, I want to talk to the nurse advocate, and then the nurse advocate will introduce you to them, and you just be like, hey, this is my issue. I got. I'm not getting proper treatment. I'm being treated like this, or I'm not getting my refills, or whatever it may be, or like the doctor keeps saying I'm okay, but I still feel pain. The doctor's gonna say you're okay, but if you keep going in, then they're gonna be like, oh, okay, maybe something is wrong, because they try to get those people and filter them out. Like they'll talk to you, but nah, you're fine, you're all right, and then they say some big old crazy story to top your story of how you got hurt, and they try to top it with someone else's story, and then they're like, yeah, see, you're fine. Well, if you're not fine, speak up. Say something. Say something, man. Speak up. Or girl, speak up. That's what you got to do. That's what you have to do. Like, be your self advocate. Speak up for yourself professionally when you're in uniform. Well, they always say, "Oh, you're a soldier 24/7." Well, that's kind of true, because you do some crap on the weekend. You're gonna the UCMJ and blah 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 blah. Like they could get you, and they will get you, and yeah. So yeah, you'll get a profile for that stuff. If you could get a doctor, one of your doctors, your counselor or your psychiatrist to ask for a letter of your diagnosis of when it started, when you came in, what's your status, and are you curable within a year? Are you gonna? Do you need further treatment? Like that's the stuff that they need that the med board wants to know, because you're gonna have over 5 to 1,000 to I had 1,300 pages of just medical stuff. 1,300 pages. Most of the paper, there's probably like maybe 10 papers in there that mattered. The rest was just like blah, whatever. So you make it easier for the third party QTC examiner to just not have to go through all your stuff. They just go through like, oh, okay, yeah, I see that. I see that letter from your counselor. I see that letter from your psychiatrist. Oh wow, he's a doctor or she's a doctor. Oh wow, yeah, I'm gonna take that word into consideration of what they're saying on that paper. Um, so yeah, verbiage is everything. So get the codes of the whatever you're trying to claim on your compensation. Um, but yeah, that's pretty much it. I'm trying to just think about stuff. This is all just raw stuff. I'm just telling you from experience. But that's basically it. And also your referrals. Um, you know, you could go from a regular counselor at EBH, and then you say you got marriage issues, and then they'll refer you to a marriage counselor, and then you could bring your spouse in there, and then it's just a big packet, and then it's gonna say like, where did this start from, right? What's the root? Like, well, were you in the service when this started? Yes, I was in the service when this started. Okay, so it's service connected. Why? Because you're in the service. You were in uniform when these conditions were developing, and that's what's service connected. If you don't go to your treatment, if you don't get help, they're just gonna be like, okay, well, he went to sick call one time, but there's no continuity of treatment, so I'm a deb the 0%. So if you're not going in trying to help yourself, that's what's gonna happen. At the end, they're just gonna be like, oh well, yeah, he went in there once, but it wasn't. It was whatever. He's fine, and that's what the examiner is gonna say. Well, there's not enough medical evidence to say anything, so I think he's fine. But then he has to give, or she has to give, his opinion on you. So you'll have like a questionnaire, and then he'll just talk to you about whatever, and based on how you're acting and your reactions, your symptoms, and that's what the QTC person will base his opinion on if he has no medical record on you. Um, and that's like IDIS, like you don't put your claim in, and you have this paper, and you just put what you have or what you were diagnosed with during the army time, and then they look at it, and then it goes all the way up to big army and goes back down. It's a big long process. Stay in contact with your Pueblo, be transparent with your Pueblo, and yeah, that's what you got to do. Um, don't be a turd. If you gotta go show up to formation, go show up to your PT formation, and then just be like, all right, Sergeant, I'm out. I'm going to my appointments. Don't be a turd. Still get up. Still handle your business. Still conduct yourself as a soldier. It's just you're a broke soldier, and you just gotta take care of yourself. So people understand that. If they don't understand that, then you need to get them out of your area. You gotta get them out, because negative people don't help you. They just bring you more down. So be around positive people and just try your best, do your best, and end of the day, take care of yourself, take care of your family. The military was here before you. It's gonna be here after you. No one cares. If you don't care, then they're gonna treat you like, whatever. They're not gonna care either. But if you put some into your words of like, hey, I need help, then they're gonna take you serious. But if you're just like, hey, hey, private, how you doing? Oh, I'm doing good. So why are you here at EBH? Uh, I don't know. Like, okay, well, get out with your I don't know, because I don't know either. So speak up right. All right. Well, that's it for that. So I talked about the physical aspect of developing injuries, or your injuries got exacerbated from your military service, and then on this video I talked about the behavioral health, the mental part of getting med boarded. Um, so yeah, get out with the 30% so you could be medically retired. You can always appeal it and do stuff like that. You'll go to JAG, so you'll get your packet of like, this is what we're gonna rate you for, and then you got like a couple of days, like a week, to sign off and be like, yeah, I consent, I acknowledge, I agree before that, you're gonna go to Jag. So Pablo's gonna be like, "Oh yeah, here's the Jag number. Go contact Jag." Jag's gonna be like, "What's up? Okay, this is what it is. Oh, this doesn't look right, or you should appeal it, or you should take it." And then when you go to the VA, you just put in your other claims, and then just go about it that way. But talk to Jag. Um, I never seen Jag steer anyone wrong, so I mean, but always use your gut feeling, your intuition. If you feel like it's wrong, then it's probably wrong. And if you feel good about it, then hey, roll that dice and good luck.